Pediatrics, like internal medicine, is a vast field with numerous subspecialties, making it difficult to generalize. Patients can be cared for in a variety of settings, ranging from premature babies to healthy children at regular PCP visits to hospitalized children with various rare genetic anomalies. Pediatrics can be viewed through a generalist or a specialist lens. As a generalist, you will be dealing with a wide range of presenting pathologies that do not necessitate subspecialized care. If you work in an inpatient setting, you would be a pediatric hospitalist, caring for children who have been admitted to the hospital. Infectious diseases such as pneumonia and cellulitis, neonatal issues such as hyperbilirubinemia and failure to thrive, and metabolic problems such as diabetes are examples. As a specialist, you concentrate on one organ system of the body. This could include cardiology, gastroenterology, rheumatology, endocrinology, and other specialties similar to internal medicine. The majority of your patients in outpatient pediatrics will be healthy children, and you will primarily focus on health promotion to prevent rather than manage a diagnosis. You'll develop a relationship with the patient and their family over time, as you may see them for up to 25 years, during all stages of development. Aside from well-child visits, you'll see the occasional case of asthma, eczema, or failure to thrive, which means poor weight gain. Inpatient medicine focuses on children who need to be admitted to the hospital. You will admit emergency department patients and work them up with labs, diagnostics, imaging, and other tests. You'll send consults to specialists for recommendations for certain conditions that necessitate specialized care. Inpatient care in academic pediatrics is frequently provided for 12 to 18 weeks. Aside from clinical practice, there is a significant amount of research and teaching, as well as various side projects. These range from quality improvement for implementing a different electronic medical record in the hospital to advocacy and going to the Capitol to lobby for better child safety protections. The most common practice setting is community pediatrics, where you work with a larger medical group. Private practice is the least common, as it is in other specialties, owing in part to hospital acquisitions of small private practices. Some people believe that pediatrics is nothing more than babysitting. That is not the case, and keep in mind that children have a unique physiology that necessitates careful attention and nuance. Acuity and sick children are certainly a part of pediatrics, though it's fair to say that on average, there is less acuity. Think again if you believe that pediatrics only involves talking to children. There is a strong emphasis on developing family relationships, and you will essentially work with at least two patients, the child and their parents. Finally, some believe that pediatrics is a female-dominated field. While this is true, the gender ratio is not as skewed as in some other specialties. Pediatrics residency in the United States lasts 3 years after medical school. The emphasis of residency is on inpatient care, but there is also continuity clinic, where you will serve as the primary pediatrician for your panel of patients. You'll have new babies when you start residency and keep them for 3 years, providing a long-term relationship that many people enjoy. The hours, as with most residencies, are demanding, ranging from 60 to 80 hours per week on most weeks. It's not dissimilar to something like internal medicine. A chief year, which adds a 4th year to your residency, is optional and best suited for those interested in academic positions who want to strengthen their CV and leadership experience. Following your pediatric residency, you can pursue a variety of subspecialties through fellowship. All of the following are 3-year commitments. Hematology Oncology, or Hem-ONC for short, focuses on treating children with blood or solid cancers such as leukemia, lymphoma, brain cancer, and others. You will also have to deal with non-cancerous blood disorders such as sickle cell disease. It is mostly, but not entirely, an outpatient specialty. This is for pediatricians who have a brain and a heart. They can be present for their patients on one of the most difficult days of a parent's life while also being highly intellectual and strategic about the best approach. This is also a highly academic subspecialty, with many PhDs. Unlike the other fellowships listed here, ICU is only for inpatients. You'll be working with critically ill children. Instead of focusing on diagnosis, your primary goal will be to stabilize and support patients so that other subspecialists can take over and follow up. You'll be dealing with sick children who are intubated, which means they're on breathing tubes and pressors to keep their blood pressure stable, and you'll assist with pre- and post-op surgical care. It's mostly acute conditions, but there are some repeat visitors, such as patients with cerebral palsy who come in and out of the ICU frequently with infections. This is for the pediatricians who know everything there is to know about physiology and apply it to the ventilator in front of them. They want to treat the physiologic abnormality and then transfer to the next level of care without getting into the details of diagnosis and follow-up. Cardiology is the most competitive pediatric specialty, and many residents pursue additional fellowships to further subspecialize within cardiology, such as electrophysiology. You will have to deal with a variety of congenital abnormalities, such as tetralogy of Fallot. You'll collaborate with cardiothoracic surgeons to determine the best time to repair these congenital conditions. Sometimes the repair is staged, with one surgery at 6 months, another at a year, and so on. These are the pediatricians with a God complex who enjoy managing complex physiology and geeking out about physics. Gastroenterology is a highly procedural subspecialty that spends time inpatient, clinic, and the procedure suite, performing endoscopies and liver biopsies. They primarily deal with chronic diseases such as inflammatory bowel disease, fostering long-term relationships. However, there is much more to it than that, such as exploring the mind-body connection, as there is a high overlap with psychosomatic disorders in children, such as anxious children with abdominal pain. Pediatric emergency medicine can be pursued in 2 ways, as a 3-year fellowship following a pediatric residency, or as a 2-year fellowship following an adult emergency medicine residency. There is no outpatient time, no lab follow-up, and no work is taken home with you once your shift is completed. It is your responsibility to stabilize children and get them to the appropriate level of care. There is less acuity than in adult emergency medicine, but when it does escalate, it escalates quickly. Pediatrics is a wonderful specialty with many rewarding aspects. First and foremost, you're working with children, and you get to have fun with them and be silly every day at work. It's unique in that you can have an impact early in someone's life that can compound to produce huge changes over time. It's a lovely aspect of the job that is unique to working with children. Because you're intervening so early in their life, this is the most effective form of preventative medicine. There are some pediatric subspecialties with poor outcomes, such as pediatric oncology, but the vast majority of your patients will improve. When compared to adult populations, there is less death, and better outcomes are always a good thing. The field allows for a great deal of flexibility, making it ideal for families. After all, these are the doctors who put children first. Even during residency, your program will be more accommodating to maternity or paternity leave than something surgical. Finally, pediatricians also consider the whole child's health, including nutrition, living situation, families, and a broader view of what health entails, rather than just diagnosing and treating conditions. Many pediatricians enjoy the data, puzzles, and detail that the field requires. They are typically interested in public health and advocacy work, and are concerned with more than just the medical aspect of the child's development. In doing so, they hope to create a more effective system for promoting children's health. Finally, the happiest pediatricians are usually mission-driven. After all, it's not a lucrative specialty, and many people enter it because they love children and want to take care of them at the end of the day.